Good evening, ma'am. I am Jared Adelbert Z. Flahaya from BSN 13. And today, I am going to perform my return demonstration in abdomen to neurological assessment. So prior to the conduct of the procedure, I go first to check the medical record of my patient. First is to introduce self to the client and identify the client and explain the procedure. So, good evening, sir. I am Jared Adelbert Z. Flahaya, student nurse from Aklan State University. So, may I know your name, sir?
I am Gabriel Aldaliga.
Your birthday?
January 1, 2004.
Your age, please?
19 years old.
Okay, so good, Gabriel, Sir Gabriel, today I am going to perform a abdomen to neurological assessment. So in assessing your abdomen, sir, I'm using inspection, palpation, and auscultation. So this is to identify any abnormalities in your abdomen. Next is I'm going to assess your neurological aspects. So, sir, is it okay with you?
Yes.
Okay, so after introducing self to the client and identifying the client, do the hand hygiene. And prior to conduct of the assessment, I already have prepared the equipment that I'm going to use. So first is I'm going to do the abdomen assessment. So first in the abdomen assessment is to inspect the abdomen for skin integrity. So good morning once again, sir. So ma-start yung kita ma-assess sa imong abdomen. So pwede ko ma-assess, sir?
Yes, okay.
Okay. After that is to inspect the abdomen for contour and symmetry. Okay. After that is auscultate the abdomen for bowel movement sound. Next is to palpate the liver. Okay, so we're done assessing the abdomen. Next, we're going to proceed in assessing musculoskeletal of the patient. So first is to inspect the muscle size. Okay, so first is to reposition the client in a sitting position. So, sir, position that sitting position, sir. Okay. Okay. So next is to inspect the joint for swelling. Next is to palpate joint for smooth movement, tenderness, and presence of nodules. So we're done assessing the musculoskeletal of the patient. So next we're going to proceed to assessment of neurological aspects. So first is to evaluate the client orientation to person, place, and time. So sir, as you can remember sir, so pwede mo mahambal sir para ang pangalan.
You're Jared.
Okay, that's great. So, sino ikaw makaroon, sir?
I am in hospital.
So, anong oras yung makaroon, sir?
It's 8 a.m.
Okay, so after that is evaluate the client level of consciousness. So, sir, pwede mo mapi yung iyong eyes, mamuklat. Pwede mo, sir, i-repeat akong hanahambal. Okay, so, beautiful,
Beautiful.
wonderful,
Wonderful.
tonight. Okay, so, pila tayo, sir?
1, 2, 3.
Okay, that's great. After that is we're going to assess the memory of the patient to immediate recall and past memory. So, before you go here in the hospital, sir, sino ikaw maghalin, sir?
Sa bagay.
Nag-alin ikaw, sir, bago ikaw yung naka-add, sir?
Pagkantanda ko nurse is nanawa ko TV.
Okay, so after that is we're going to assess the abstract reasoning of the patient by asking the patient to explain his understanding in the proverbs such as the early bird catches worm. Okay? Sir, may hambaw na ko mo sir nga statement hambaw mo sir imong understanding by explaining. Okay?
Yes.
Okay, so sa tingin mo sir, ano yung pagkaubot sa the early bird catches worm?
For me, the early bird pertains as human people that we should have to be fast in order for us to have a fast opportunity in our life.
Okay, thank you. So after that is we're going to evaluate the client's ability to understand spoken and written words. So, sir, may isugat ako iya, hambawin mo kung alin ang isugat, sir ha? Okay, kimo sir? Okay. Ano, sir?
Hi.
Okay, so, next is, i-repeat mo sir kung alin ang hambagon. So, nurses,
Nurses.
healthcare,
Healthcare.
provider.
Provider.
Okay, that's great. So next is we're going to test the cranial nerves of my patient. So by first asking the patient to close his eyes, cover other side of the nose, and let him identify what scent I am going to put in his nose. Okay, sir. May ipahula ko mo sir nga mga scented items. But first, i-close mo yung eyes, sir. The other side of your nostril. Okay.
So,
Okay. Other side of your nose, sir.
baby are
Okay, that's great, sir. So, next is we're going to test the visual acuity and the pupillary constriction of my patient. So, sir, may Snellen chart kita ito, sir. Set of letters. So, pwede mo, sir, mahambal kung alin na itong mga letters starting from the top.
E, F, E, T, O, Z, L, P, E, D, P, E, C, F, D, F, E, J, K, C, L, O, M, K, B, A.
Okay, so i-check natin sir imo nga pupillary constriction. So do kang iya ka sir. Okay. Okay. So next is we're going to test the eye movement of my patient by using the 6 position gaze. So sir, tuwa kang ikaw tadlong, tuwa ko mo dahil ballpen ang sundon mo ima, okay?
Okay, nurse.
Okay. After that is we're going to test the facial nerve of my patient by asking the patient to smile, prone, wrinkle head, and pop cheek. So, sir, itest na ito imong cranial, imong facial nerve. So, pwede ka mag-smile, sir. Prone, wrinkle forehead, pop cheek. Okay, so that's great. So next is we're going to test the hearing acuity of my patient. First, in the normal tone voice, and second, in a whisper tone voice. So sir, hi, pwede mo matakpan yung other side of your ear. I-repeat mo kung alin ang hambawan, sir. Okay? Okay, so School of Arts
School of Arts
and Sciences.
and Sciences.
Okay, to the other side, sir. Nursing.
Nursing.
Profession.
Profession.
Okay, so next is we're going to test in a whispered tone voice. So, cover your ears, sir. Um,
Beautiful.
um,
What is?
okay. So, after that is we're going to test the gag reflex of my patient by placing a tongue depressor into the posterior of his pharynx. And also, don't forget to explain to the client that by doing this procedure, he will feel uncomfortable. Okay? So, sir, hi, test ato ni mong gag reflex. So, butangan ako nikaw tongue depressor is sa may imong ngala-ngala. Tapos, hi, by doing the procedure, sir, hi, pwede ikaw maka-feel it uncomfortable at medyo maduwal. So, okay mo, sir?
Okay.
Okay, so by first is do the hand hygiene to wear um, set of clean gloves.
So now what's in your opinion?
Okay, say sir.
Ah,
Okay, so mamatay ko na dual, sir.
no, not that.
Okay. After that is to test the resistance of my patient. I will ask my patient to stand and push the resistance, okay? So sir, pwede ka magkatindog, sir? Okay, like this, sir. Diba? So, i-push mo yung sir, ha? Okay, so you may sit na, sir. So next is, I'm going to ask my patient to resist into the other side of his cheek. Okay? Okay, other side, sir. Okay. So next is I'm going to ask my patient to extend his arm and rapidly turn the palm up and down. Okay, sir. Extend mong arm, then palm up, down, up, down. Okay, so after that is I'm going to ask my patient to close his eyes and let him identify what number I'm going to write in his palm. Okay? So sir, pwede mo close mong eyes. I-identify nimo kung anong number akong isuwat sa imong alima. Okay? Okay. So, give me your hands, sir.
One,
Okay. Other hand, sir?
two.
Okay, that's great. So next is since my client is already closed his eyes, so I will going to let my patient to identify what materials I am going to put in his palm. So, sir, may ibutang ako sa imo nga alima, i-identify nimo kung ano to ha. Okay. So, okay, great.
Hello.
Okay. So next is we're going to test the tendon reflexes of my patient. First in the wrist, antecubital space, tricep, patella, and Achilles. So with the use also of reflex hammer. Okay. So sir, open your eyes na sir. Okay, other hand. Okay. In your fibula. Okay, in your tricep. So, in your left. Okay. So next, I'm going to stroke the sole of my patient to test his cranial nerves in the foot. So that's it. So next is I am going to assist my client into a standing position and observe my client while walking in a regular gait. Okay, so sir, tindog ikaw sir. Uh, tikang ikaw sir. Okay? Okay, 1, 2, 3, go. Okay. So, since he already in a standing position, now I'm going to use a Romberg's test. With closed eyes, both hand in the side and both feet flat on the floor to observe my patient ability to maintain balance as well as swinging of body. So, for 20 seconds rather. So, sir, close eyes, both feet flat on the floor. Okay. Okay. So now reposition client in a comfortable position. So bubugon ikaw sir. Okay. And finally, document the procedure from the start to an end. So that's it for my return demonstration in abdomen to neurological assessment.